Post-traumatic stress disorder, or PTSD, is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Most people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self-care, they usually get better. Symptoms may start within 1 month of a traumatic event, but sometimes, symptoms may not appear until years after the event. They are grouped in 4 types. First is the intrusive memories. It may include a recurrent, unwanted distressing memories of the traumatic event, reliving the traumatic event, as if it were happening again, or flashbacks and upsetting dreams or nightmares about the traumatic event, severe emotional distress or physical reactions to something that reminds you of the traumatic event. Second is the avoidance. It may include trying to avoid thinking or talking about the traumatic event, avoiding places, activities or people that remind you of the traumatic event. Third is the negative changes in thinking and mood. It may include negative thoughts about yourself, other people or the world, hopelessness about the future, memory problems, including not remembering important aspects of the traumatic event, difficulty maintaining close relationships, feeling detached from family and friends, lack of interest in activities you once enjoyed, difficulty experiencing positive emotions, feeling emotionally numb. Fourth is the changes in physical and emotional reactions. It may include being easily startled or frightened, always being on guard for danger, self-destructive behavior, such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritability, angry outbursts or aggressive behavior, overwhelming guilt or shame. For children 6 years old and younger, signs and symptoms may also occur, such as reenacting the traumatic event and frightening dreams. You may have more PTSD symptoms when you're stressed in general, or when you come across reminders of what you went through. Getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. If you or someone you know has suicidal thoughts, get help right away through one or more of these resources. Reach out to a close friend or loved one. Contact a minister, a spiritual leader or someone in your faith community. Call a suicide hotline number. Make an appointment with your doctor or a mental health professional. If you think you may hurt yourself or attempt suicide, call 911 or your local emergency number immediately. Doctors aren't sure why some people get PTSD. It is probably caused by a complex mix of stressful experiences, including the amount and severity of trauma you've gone through in your life, inherited mental health risks, such as a family history of anxiety and depression, inherited features of your personality, often called your temperament, the way your brain regulates the chemicals and hormones your body releases in response to stress. The most common events leading to the development of PTSD include combat exposure, childhood physical abuse, sexual violence, physical assault, being threatened with a weapon, an accident. Having PTSD may also increase your risk of other mental health problems, such as depression and anxiety, issues with drugs or alcohol use, eating disorders, suicidal thoughts and actions. After surviving a traumatic event, many people have PTSD-like symptoms at first, but getting timely help and support may prevent normal stress reactions from getting worse and developing into PTSD. PTSD can be treated in 2 ways: short and long-term psychotherapy and medications. Always remember, if you have diagnosed with PTSD, it is not a sign of weakness, rather it is proof of your strength, because you have survived. Trauma created change you don't choose, healing creates change you do choose.